Hello, I'm Dr. Nola Knowles, or Dr. Courtney Avion Washington, and welcome to my podcast. Today we're going to talk about these dreaded things that we call in medicine
prior authorizations.
If you are a doctor or a patient, these are the bane of your existence, and we're going to dive straight into it. So let's dive into the history of prior authorizations. Prior authorizations are a tool that insurance companies use to keep healthcare costs low. It was started in about the 1960s, and it was meant for very expensive medications or procedures to control healthcare costs. But since that time, it's evolved into an administrative paperwork nightmare. For instance, if I send a medication in for a patient that needs it, say it's for a rash, and this medication may be expensive if they have psoriasis. Let's say topical steroids did not work, and I'm going to prescribe a medication that's an immunosuppressant like Xeljanz or Humira. When I send that prescription to the pharmacy's computer says, voila, needs a prior authorization. So then they would send in that request, I'm guessing, because I'm not a pharmacist, but I would get an email that says, hey, you need to complete this prior authorization either online, or you can call us, or you can fill out this paper and you can fax it to us. And this is where the paperwork nightmare begins. Now I'm required to either call or go online and justify why I am prescribing the medication, which in order to even get paid for seeing the patient, making the diagnosis, and prescribing the appropriate medication, I have to actually write out or dictate in the first place. And a lot of the times, the medication is only used for a handful of disease processes. So the questions will be redundant, like, is this patient's address correct? Yes. And are you prescribing this medication for the FDA-approved indication? Yes. Have you tried these lesser, cheaper options? Yes. And so this automated system will ask me these questions. It takes me about 5 minutes to complete. Sometimes they'll even ask me to upload a copy of the patient's labs and documents. And I'm not sure if it's an automated system or if it ever sees a person, and sometimes it'll be approved or denied. It just really depends. If that medication is denied, it will send me an email and why it was denied, which I believe is an automated message. And then if I'm really convinced that this patient needs the medication, I can do an appeal. So an appeal process means that I write down, hey, this medication is needed for, say, plaque psoriasis. They failed on this medication, that medication, and so on forth. In the event that the medication is still denied coverage by the insurance company, then I can do another appeal and ask for a peer-to-peer, which you would think that I would be speaking to another doctor in my same profession or a specialist that's a dermatologist. Sometimes it's not. Sometimes it's a surgeon or whoever is available at that time, and I would discuss with that physician or provider why the medication is needed. All of this is very time consuming. It is not reimbursable by insurance companies at all, and it is extra paperwork and a barrier to care and the patient getting the medication that they so desperately need. It's a never-ending loop. Some bigger practices actually hire more staff just to complete the prior authorizations. To add insult to injury, whenever a prior authorization is called in, instead of doing it electronically, sometimes I'm speaking to a person that cannot even pronounce the name of the medication or the alternative medications.
Oh my God! Oh my God!
I think that prior authorization should be done away with. There's no space for it. It actually is a barrier to care. An alternative would be sending in your medical note and having the insurance company read over it. There's no time or space. It's just a waste of physician resources to repeat the same things that they had to write. It's just one of those delay, deny tactics, and it's really having a negative impact on healthcare. It's decreasing the amount of physicians that we actually have that are practicing, and it's also keeping new, improved, better medications away from patients. There has to be a happy medium, right? So let me know your thoughts, what you think about it. I hope that there's new legislation coming down the pipeline that will prevent these prior authorizations from adding more healthcare expense and healthcare cost. I know it's an increased cost on the behalf of the insurance companies as well, but hey, I don't know many physician practices that are making $22 billion in profit.
Oh my God.
Let me know what you think. This has been another episode of All About the Medicine with Dr. Nola Knows.